Hi, Chris. Welcome to the show.
Hi,
Thanks for
Pranay.
being here.
It's a pleasure to be here with you.
How are you doing today?
Beautiful. I'm really honored to be a part of what you have going on. What, episode number 5?
We are at episode number 4 actually.
Ooh, number
Yeah,
4.
number 4. It's a good number. We catching up, and then we just very lucky to have people like you coming in.
Thank you.
So
Yeah,
we're
it's an honor to
excited.
be here.
So I think the first thing that I wanted to sort of like start off with was just we always start with stories around like people who have been in the space like you have. So I wanted to understand a bit about your background, what got you into the space, and yeah.
Personal experience brought me here. My love for working with people is what's kept me here. So the story behind it is I was what they would consider a troubled teen, an adolescent. I struggled with mental health and substance use from the time I was very young.
Okay.
And spent most of my adolescence in and out of treatment programs, alternative placements, jails, wilderness programs, military schools,
Wow.
for about 10 years. And I ended up getting sober in my early 20s, and I wanted nothing to do with this industry. So I was not the person that got sober and then said, oh, I really want to help people.
Okay. Interesting.
I actually looked at the industry and thought they didn't do anything for me. And that's not totally true. There were some great people along the way, and some people I still have relationships with 25 years later that knew me when I was 16 years old and really struggling. And however, my experience was that a lot of the things that were driving me into behaving this way, into using substances in these ways, to medicating in these different ways, it didn't get addressed. The underlying kind of causes and conditions didn't really get looked at, and so I didn't really have much belief in the industry. However, about a year and a half sober, a friend of mine in the recovery community said, hey, I think you'd be really good at working with people. And I was 25 at the time. I didn't have a lot going on in life. I didn't have a lot of responsibility. And they said, why don't you go interview? And that was the first job that I took for a treatment program in San Diego. And then very quickly learned that I was really falling in love with the idea of being able to connect with people in a heart-centered way, that I understood the pain and the suffering of what it was like to struggle with mental health and substance use. And so really from there it was just that ability to sit across from another person and be able to really connect with them in a way where they understood that I understood how they felt, and that I was with them on the journey. And so that's a bit of what brought me in to the field.
That's a really good story. So you were not really planning on it. It just so happened that someone talked to you about the opportunity.
Yes, and I said this recently to somebody, is that a mentor of mine about 5 years ago said, sometimes you have to fall in love with your purpose. And I've struggled on and off over the years about, is this a field I want to be in? Should I be in? I'm sure we'll dive more into, a lot of the intricacies of what behavioral health as an industry is. But I really resonate with that idea, that I do believe that this is one of the reasons I'm here, is to work in this field and to be creative and to bring curate experiences to people, and to care for people and create environments for healing. And so I think for me, yes, it wasn't that I woke up one day and this was my path. It was really, I've had to fall in love with behavioral health over nearly 2 decades.
Okay. Talking about falling in love and like the relationship, how's the relationship been with the space? Like, what's kept you in here for like, what you said, 20 years?
Well, it's been almost 17 years.
Okay.
And so a lot of people that knew me in the first 10 years of my career, I was very ego-driven. I would say things like, I came in the industry with a chip on each shoulder, and based on my experience of being an adolescent in care. And so much of what I did in terms of working in the field, building in the field, creating, was really, it was very ego-driven. And very much from a place of insecurity as well. There was a lot of work I still had to do as
So did you
as a
believe
man.
that? Was that?
No, I didn't know that at the time.
Okay.
No. I mean, I did not know that at the time. Again, a lot of those, now we're diving like into the, like, let's call it the therapy side of things, but I had so much growth that had to happen as a sober man. And so a lot of those behaviors and ways that I showed up in the world were, they were defenses. And so it was a lot of like, I know better than, right? And so there was a separation from the industry. And so in that, what I would do is I would take a lot of the weight of the problems of the industry on my shoulders, and I would kind of say, like, it's my and our responsibility to kind of solve this. So you're fighting problems like big pharma, you're fighting insurance companies, unethical and immoral treatment providers, right? Like there's a myriad of issues that the industry holds. But those are the things that would keep me up at night. They would create a lot of anxiety, and that's how it would show up. It's like, we have to do something about this. And so I crashed and burned after 10 years of that.
Okay.
And
was this because in the beginning when you talked about like the story, you kind of mentioned that even though you got sober, the industry didn't serve you as much as you would have wanted it to. So was that belief still something that you carried like through your time in the industry? And that's
absolutely.
Yeah.
And so I would be really front and center if I didn't think you were running a good program, if I thought there was deficiencies, if I thought things should be done differently. Like I was very vocal about these things. And so a lot of people liked that. And then that also does create things like enemies or people that don't like you. And that's okay. At this point, right, I turned 40 this year. I'm far more comfortable with the idea that I'm going to be for some people. I'm not going to be for some people. However, I think that the growth that's really happened over the last like 5 years, I would say, has been much more from the position of how do we come together? So how do we work together? How do we collaborate? How do we create solutions together? Versus Chris knows best. Versus like, how do we ask better questions? How do we connect with better people? People that are continuing to think forward, and then how do we come together?
Got it. I mean, I don't know if I'm getting this right, but like there is something to be said about if some people, I don't know if it's hate is the right word, or like are in the way of what you're trying to do, you're probably doing something right. So
yeah, I mean, there's a lot to unpack there, which is that I know that I came into this world questioning the world.
At a very early stage.
Yes. I mean, I think back as far as first grade. It was my earliest memory of thinking and knowing that school wasn't for me. And then, right, you got a long time between first grade and graduating high school where there's a box and you have to fit in that. And so I was always just somebody that was questioning what was going on in the world. Why are we doing this? Why do I need to do this? And the world is not set up very much for people that
asking
ask questions
or like questioning the
challenge the norm. Right? Like, this is how we've done it. This is your expectations. You get up, you do this. Here's what your life's supposed to look like. And so I never fit into that box. And so I agree that when you are taking a forward-thinking approach to things, especially that may ruffle the way that things are done, people are going to have a response in one way. They're either going to really connect with it and be like, ooh, like this is something I want to get behind and be a part of. Or, hey, maybe that's not somebody that we're very interested in having a relationship with, which either of those
which is fine.
Completely okay.
Yeah. You got to like pick and choose.
Exactly. And you find your crew, and you find, and what I would say is different today versus, years ago is I would say, well, that I don't care about them. Now what I would say is I still want to be at those tables. I still want to be at tables with people that are continuing to ask questions and to challenge even the way that I'm thinking about something. Even if they don't agree with me, even if they don't agree with forward progress or innovation or, whatever it may be, I still want to be at those tables because I still think that there is a lot of value in being able to hear, differing opinions on things.
Do you think it's a problem of messaging or just the core beliefs of how things should be run when it comes to conversations like these?
There's a lot to this, which, it's June 2025. I think one of the biggest challenges we face as a society is our inability to have differing beliefs, but still stay in the conversation with somebody, whatever it may be.
100%. Polarization is through the roof.
Yeah, and we're so divided. And again, I'll just speak to the United States, but we are so divided in the United States in our ability to sit and have differing beliefs and to remain stable and grounded in that conversation is just something that is becoming less and less frequent. When it comes to the industry, I think that it's so ripe for innovation, and yet there are still so many people that are just stuck in this is the way that it is done. This is the way that it has been done. We get very rooted in our belief systems, and that's safe. Right. So
right.
It's understandable that once
it's safe until it isn't.
Correct. At some point, that's going to probably not work too well for you, but there's safety in this is what I believe in. Here's my belief system. And when I'm challenged in that, right, like I have to get to a place where I'm okay with conflict, or I'm okay with having my belief or the way I see the world or a particular challenge or problem challenge, right? Conflict. So how can I remain in conflict? And so I think that is really what breeds innovation, is that ability to sit with people that think differently than you, and to be able to challenge the way that one or a group of people, or two people sitting together can continue to challenge and grow, because there's going to be things like respect and shared values and some different things like that. So the dividedness is a continued challenge, not only in the industry but really at a macro level.
Sort of like talking about innovation, sort of fast forwarding to today, like you just started Ava Health. Maybe talk a little bit about what made you probably noticed a gap in like how things were done. I know you've talked about that before. So what got you into it? Like, tell us a bit about the program, maybe.
Ava Health coming to the western slope of Colorado, August 1st. I spent 5 years after an exit in 2019, and it was not a very fruitful exit. It was painful in many, many ways, and I would look at it as a failure in many ways. And my career, I think, has been a culmination of a lot of failures and a little bit of success, and just continuing to move forward and being okay with how things need to change and to grow and to improve, not only from a business perspective but personal level. And so Ava Health was absolutely born out of really about 5 years of being in the industry, but really just paying attention. Where are the gaps? What are people doing really well? Where are we potentially missing it? Where is opportunity? Where are demand for services? How could we continue to be really forward thinking about the ways that we look at these businesses? And so Ava Health started there. And that was one of the things that was unique, is I've started multiple companies in the space, but they were always out of kind of Chris's idea. I have found this, I have found the problem, the challenge, and now I can create something, versus where we began with Ava Health was asking questions, and we started talking to folks at the state level in Colorado and simply saying, like, tell us about behavioral health in the state. Talk to us about what you were seeing on the front lines. Those conversations became more conversations and different stakeholders, and really stakeholders at the state level, and then what became the regional level out on the western slope of Colorado, where people started to say things like, people are incarcerated longer than they need to be because there's no treatment available. And people in Grand Junction, Colorado, are being flown over to Denver for care. And these are Medicaid clients. So we started to say, like, that seems like a really expensive and inefficient way to care for people, is to take them out of their home and to fly them over to Denver, or drive them, 8 hours round trip to a hospital and then back. And so for us, we really began to embed into the community and ask those stakeholders what challenges they were experiencing on a daily basis as it related to behavioral health. So it was talking
this
to
Grand Junction,
and in Mesa County and Grand Junction, was saying to the sheriff's department, tell us about what you're seeing in the jail. Talking to local providers, talking to the Department of Behavioral Health and Public Health, and just all different stakeholders to really get a sense of what were the biggest challenges that existed, and then saying, I think we can create a solution that would meet those needs. And so that was really the formation of Ava Health, was taking all of the information that the key stakeholders were giving us on the front lines, and then building what will be a full continuum of care for behavioral health, mental health, substance use, co-occurring, from subacute stabilization all the way through mental health transitional housing. And so then just starting to think really creatively about how can we replicate what we know about out of network and private pay treatment, where you have so much flexibility and so much ability to be creative and to provide really quality care and hire wonderful people and build great cultures and have good outcomes. But how could we do that and create access?
Right.
And so access and healthcare equity in particular was just a real strong passion for my partners and I, was how can we really take the forgotten populations, the institutionalized populations, and how can we create something that would traditionally only be accessible to people if you had money or really, really quality insurance. And
so tell us a little bit about that then. Again, it sounds fascinating where you're able to take the level of creativity or the level of care that you have in private pay and like make it more accessible. Like, what's enabling you to sort of do that? I'm sure there's a myriad of ways in which you guys have been figuring it out. It sounds like 5 years of research at least, if not more, specifically on this.
Yeah, and really 18 months that my partners and I have worked together. What has allowed that is having a team of people that don't see barriers. And that is one of the most unique things I think about our team, is that we have what we've kind of coined internally a culture of curiosity. So most people would say, well, you can't do that. You can't create private pay experience of treatment for Medicaid.
It almost seems diametrically opposite. Yeah.
So we would say, why? Right? So then we would just keep asking why. Well, okay, well, here's the issue with rates. Here's the issue with this. Here's the issue with staffing. Okay, can we solve for that? Can we solve for that? Can we solve for that? So what makes us unique, I think, was our kind of continued desire to say, how can we make this work? What are the challenges? What are the barriers? How can we eliminate those barriers? And also, I would say that it's also understanding the system that you're in. So it's easy to say, well, you just can't work with Medicaid. They're too difficult to work with. We've heard horror stories from our friend down the street. They don't do this, or they're really challenging here. And again, saying, well, why? And what would happen if we went and built a relationship with our local Medicaid payer? And had these conversations with them. Here are challenges that people do experience working with Medicaid. Is this? How could we alleviate that barrier or that challenge? How can we work together more effectively? How can we collaborate? I truly believe that at least the folks who are delivering, who are with the payer system that we would be collaborating with, they got into that to be helpful. I don't believe that they're like evil sitting behind the desk saying, how do we not pay Ava Health today? Most of them just want to be heard. They want to have a relationship. They want to feel some kindness and some collaboration in that. And then those open more and more doors to possibility and opportunity. So some of like the tactical is when you look at rural real estate costs. So people would say, if we built this in New York City, we'd never be able to do it because the real estate costs would be, out of this world. So real estate costs are lower. Cost of living is going to be a bit lower. Living wages are going to be a little bit lower. But then it's to take it into a place of saying, how can we use technology, for example, to optimize operations? What could be automated in this business? And since we're not having to go back and kind of fix it, right, or implement new systems and technology,
we're kind of building ground up right now.
We're able to look from day one and say, these are challenges that we know exist constantly. My partner and our CFO has been running companies in the space 35 years. My CFO, over 15 years, and comes from investment banking and private equity, but understands how spreadsheets and numbers impact the human being in this space. And so you pull a team together to start thinking about, okay, what can we automate in this? And again, my CFO I'm not sure how he'll feel about this, but he literally said to me the other day, he believes with the technology, with AI, with automation, and the technology and the systems that we're building, that between him and one other staff accountant on our team, we could run in 5 states.
Wow.
Financial operations optimized like that, you can now see where can we take that money and where can we reallocate it. When we start thinking about how could we optimize marketing, how quickly could we be able to get data from an interaction, have that analyzed against other data and tell us exactly what our next step is to be. We're taking marketing costs and completely bringing them down in this, where we can reinvest in staff, where we can build great cultures. So for us, it's really this combination of saying, what states, for example, do have a significant need. They're going to have some rates that are sustainable. We also realize you have to build the full continuum of care. If we were just going to do a residential treatment program, the rates are not good enough to sustain unless we had something like 200 plus beds, which we don't want to do.
Right.
So there's just a lot of ways to look at it, but for me it comes down to also really aligning with people that really understand the tactical integration and execution of these businesses, like my CFO and COO, who go, great, Chris, we have this great big vision and all these great ideas, but now let's take it and actually operationalize it and then look at how this is actually going to work. But I think that technology in particular and where we are right now is a way that we're continuing to say we need to be really like AI first, technology first. It's not to provide care through technology. That may be something that we can adjunctively use as support down the road, but really it's how do we look at the operation from a technology first perspective to say how can we take that to lower costs across the organization to then reinvest into these different things like client care and culture and all of that. So again, there's a lot to unpack, and it would make sense to look at like a financial model of what that is, but those are some tactical things as to how we've really been able to look at and say we can get this business pretty comfortably to about 15-17% profit margin by treating a primarily Medicaid population in
with a private care sort of a level. That's fascinating. Can you give us a few specific tactics in like how you're using, again, technology, AI, automation in the field? Like you talked about like marketing, bringing that down.
I mean, look, I think for like anyone that's watching, what's cool is a year ago, I think about it this time, your partner and I we all started having conversations about potentially just hiring an AI team in-house, which at that time we were like, maybe we just hire you guys to like be the AI team in-house that can just constantly be building technology to optimize all these different things from CRMs and EMRs and build our own technology and our own systems. And I think that from that standpoint, you'll have to repeat the question because I've got my head over my skis.
No, that's fine. Like the question was that you talked about like the idea of like using AI and automation. Like for the people who might be listening in, it's often not very clear because again, some of the folks are still getting up to speed on it.
Sure.
So how do we, like now that you're just talking about it, you actually operationalized it and actually using it. So what are some like tactical ways, a few that come to mind in which you're actually able to use AI and automation to bring down your operational costs, be it marketing, be it on the financial side?
It's such a fun conversation. We've taken the approach of every conversation that happens when we talk about operationalizing any part of the business is can we use technology to either do some of this, do all of this, or what is the way that we can utilize technology to help us be more effective and efficient with it. So I think first and foremost, it's just being able to ask the question and be in rooms with people that have an open mind to say, okay, let's look at this. So, I mean, you can think about compliance is like a really easy one, right? Chart audits, which is like the nightmare of many clinical directors and clinical teams. You can implement an AI agent to automate chart audits and to get to 100% compliance on documentation, very, very simply, right? So then it's being able to have somebody in a position financially to start quantifying the return on that investment. So what is that going to do to your clinical director if they no longer have to do the chart audit, but all they have to do is look at the chart analysis, for example? How much time is that going to save them?
Yeah, and that's freeing up time to connect more with patients, probably.
Correct. And that's like one of the important things. And we say it to like people that we're hiring and onboarding. We only have a team of 10 right now. And we'll have a team of 100 within the next 90 days. But we've got like all of our directors in place. And as we've really gone through the process of hiring and bringing folks together, it has been that we're not using the technology to give you more. We're using the technology to simply give you more time. right? And that's one of the things that culturally we speak to so often in the business is people feeling really overwhelmed.
Yep.
Right?
Burnout is like the number one thing that we keep hearing.
Yeah, so clinicians, right, they got in this space because they want to help people. So how do we give you the tools and the resources to do what you feel like you were born to do more effectively, right? So it's not about now we're going to give you a caseload of 25. It's we're going to still keep your caseload at 12 or at 8. However, you're going to have these things in place that are able to help you so much, whether it's, again, simple things like dictating documentation. And so from a clinical perspective, the example I like to give is, what if a clinician walked in Monday morning at a residential treatment program and they had AI technology that was able to take their entire caseload from the weekend, read through all the notes of the weekend, all the encounters over the weekend, what happened, give them a quick summary of their entire caseload, some of the key areas that came up, how it relates to their treatment plans, and then can you give me 3 ideas for a group to run at 9 in the morning? That saved the clinician an hour of time easy, but also is using very tactical, right, data-driven insights to say, this is what my group should be on. Not just we're going to go in and do a process group, but we're going to have a very specific process group based on trust, because trust was the thing that was identified as a key concept that was coming up in every encounter with my caseload this week. So now I'm able to go in and provide more targeted, clearer care based on their treatment plans, as well as what their goals are, right? So, you know, from a compliance perspective, from a clinical perspective, marketing is a fascinating one. And, you know, we could talk forever about this, but how quickly can technology start to tell me how effective my team is at driving referrals from a conference we attended, right? So we're at a conference right now. How quickly can the information come from this conference within a few months to show how many phone calls came from that, how many admissions came from that, how long were those people in treatment, were they good admissions, were they good interactions, good quality calls. And so it's one of my big problems with the industry is that we don't really use data because traditionally it's taken so much time to...
Got it. It was not as accessible.
Well, you get it into the system, then you have to run a report, then the report has to tell you something, then you have to analyze the report, then you have to talk to people about the report, all of these things, instead of using the technology to simply tell me that was a really effective interaction that you had with Prannoy. We did this podcast, and then this is what happened. Right? So, now let's help my team figure out maybe getting on a podcast is like a really good move versus all those coffees you had, they really didn't do much. Right? So again, relational marketing is a long game, right? It's taken many years to build the relationships that I have and to build the collaborations. But I think that the opportunity to take the technology that we have, many people are just scared. They probably should be, right? Because leaders are going to have to step up and say, look, if I'm spending 20% of my OPEX budget on marketing, I need to be able to justify that. How am I justifying that? And if we're not using tools, and this is totally a plug, but if we're not using tools like AI forward and first CRM systems where I need to put the data in so then I can be told how we're doing and how we're working. If my admissions team cannot say, this is how long it takes from the first call to an admission, there's a problem. It's the most basic data that we should have. Now, I also want to caveat this and say, I operated many years without this stuff. So these realizations or insights come from many years of failing at this. So this is not like I've just been doing this for the last 15 years. This is recognizing back to the idea of gaps and what's working and what's not working is saying, if we can't say this is how quick from a first call to an admission, that's a problem. We have to solve that. So what can we use, right, to help us see that data and see it in real time and then be able to act on it, right? And so those are just some of the tactical ways of starting to look at how can we automate and how can we use technology to really support our team and just being more effective and ultimately making more money serving more people, having better outcomes, right? At the end of the day,
everyone wins.
Like that's it, right? So it's people starting to see that we can really bridge mission and margin into one and the same. There is nothing wrong with making money in the space as long as what we can do is we can back up that with data and outcomes.
Yeah, 100%. Talking about the future a little bit, like this is 2025, like you said, I'm sure like a lot has changed in like the past 17 years that you've been in the industry. But are there things that you're excited about? We talked about the AI, the technology piece, but overall, when you think about the space, what are a few things that come to mind that like, this is really where it's going and I better be prepared for it?
I mean, technology number one, right? And it's easy for me to sit here and say this, but it's we have so much technology right now, and technology is advancing so quickly that it's really hard to stay on top of the latest advancements. I mean, no matter how deep I am into AI and tech, I'm constantly amazed at the next thing that's launched and how can we use this? Can we not use it? So technology excites me a lot. Not as much in direct client care. I think there's a lot of hype around like AI. It's called AI therapy. I don't think it's AI therapy, but kind of let's call it AI peer support and things like this. They could have a place, and they probably will have a place over time. But I think the opportunity to optimize operations it's ripe. Like the whole industry is just ripe for innovation and how we run the companies that serve people. So I think in the technology conversation, that's really the foundation, is how do we partner with, how do we open our eyes and to continue dialogue around how technology can actually assist us, and also how can we then get over this hump of how do we implement technology, because I think that's one of the biggest barriers folks have is what you have sounds beautiful, but how do we integrate that? How is that going to be operationalized? My clinicians struggle to get the group notes done every week, but now you want them to do something else. And so that again takes some operational 100%. Wherewithal. I'm most excited too that I think we're really primed to have really sophisticated operators enter the space. I think it's one area that I've seen in recent years is really lacking. We have wonderful visionaries, we have good finance people, we have great clinicians, great medical teams, but I think one of the big gaps is the true operator. How do we take these systems, these tools, these processes, these resources, the data we have, all of that, and actually make tactical decisions in integration and execution? I think when you start to look at some of these things and bring them together, we have better outcomes. We have to. This industry cannot continue to survive on 5 or 10% of people actually getting well. And I'm not going to sit here and start to have some God complex that I think we can get to a place where 90% of people get well and things like that. I mean, maybe somewhere down the road in the future, but I think we have to say, we have to have data. We have to be able to speak to our data. We need transparency. We need to be accountable. And when someone calls us and asks questions, we need to have answers to those questions. They're very reasonable questions that families might have around success and what am I going to get in this treatment program, and what is that going to look like? And so I think what excites me the most is that, but it's also really starting to work with communities. I think that for far too long, what we have done is we have looked at and said, there are so many problems and so many challenges, and we're struggling with fentanyl, and we're struggling with suicide, and we're doing this, but like actually sitting down with communities and having conversations, going to, again, police departments or religious organizations and saying, like, who do people come to in this community and talk to? And then asking if you can sit with that person and say, tell me what this community is truly experiencing right now. Do we need another 6-bed detox in LA that's private pay?
Right.
The answer is no, we don't. However, I think that people are going to really start to see that in rural communities and in underserved communities, there is so much need
Right.
That
Right.
we don't need to be running around spending $1 million a year on PPC if what we can do is open up in an area where there's no care.
Yeah.
And we can serve those communities and we can be really creative around it. I think that it excites me to see people starting to think this way. And we're starting to see far more people, I would say, starting to think about innovative solutions.
Yeah.
And there's always going to be a lot of innovation in private pay because you have the money
Resources,
to really
yeah.
do it and the resources. But people that are really starting to say, how can we serve underserved? How can we really create access? And for me, that's what continues to light me up. And I know will be the rest of my career in this space. I am fully confident that the rest of my career will be really built around this idea of how do we create high quality, accessible services to underserved communities. That's what continues to excite me. And I think that there's a lot of people starting to think about that. Yeah. And there's a lot of the industry starting to move forward with thinking about technology, thinking about operations, thinking about some of these things that I'm not sure we've really done a really deep dive on over the last decade or so.
That's fascinating because I think, and I imagine that's also where you see a lot more of the need growing, where like these underserved communities where they don't have the access, and that's where you need to fill that gap. In our conversation, you almost I would say talked about your playbook a bit. Do you, I think you've posted openly about you want to build in public. Is that something that you care deeply about in the sense that you don't want to do it all, but you want people to be able to learn from what you're doing?
Yeah, it was a unique thing because building in public is not super unique. I think it's a thing that's happening in a lot of industries right now. I think for us, it was, we thought from what are some of the really key values that we have, and what are some of the things that are really important to us, and transparency and accountability were really two of those that we just don't see a lot kind of industry wide, right? There's a lot of people that say, oh no, it's it's a secret what we do, or we don't talk about that, or we don't have access to that, and even within organizations, people would say I don't have access to the numbers, I don't have access to this department, I don't have a relationship with
even silos within a
correct. So within an agency, there's significant silos that existed, and so for us, I think what we said was, if transparency and accountability are really kind of fundamental to who we are, then we have to do this just really out in public. And so we get to share all of the good and a lot more of what's not working.
Which is probably more important, in some sense.
I mean, I've learned far more from the things I've not done well over the years than what I have done well. And so Build in Public is something we're very committed to today, as well as continuing to move forward, which is really publishing out in front everything that we're doing. And so once we close on our office space this coming week, we'll build a podcast studio, and at that point I'll really be able to get our CFO in every week, and he'll be able to get up and screen share our financial modeling, and he'll be able to talk about the changes that he's made this week based on federal Medicaid cuts that may come down at this point, and how he's looking at that, and how he is planning strategically around potential Medicaid cuts, and then what he's going to need to do on the finance side, and then how that's going to play out operationally. And I'll get our our COO in there. And really, so for us, it was saying, so many people come into the industry, and there's not a lot of mentorship. There's not a lot of people that are, taking folks under their wings and guiding them, and kind of partnering with them and bringing them up. And so for us, it was saying, let's not only be front and center for our clients and our families and being able to show our data and outcomes and what's working and what's not, and own and be really accountable, but also is how do we really support the industry and continuing to move forward. And so, David can get on and talk about what it's been like to build out automations and AI with our underlying ERP software, and maybe what that can do is actually save somebody a whole lot of time and money.
100%.
Because he's done the research.
He's
gone down the road. He's made the mistakes. He's wasted the time. Now he's able to share that, which hopefully then saves somebody money, time, and they can help make a decision on, is Sage better than NetSuite for their accounting and ERP systems? And so Building in Public for us is this opportunity to really just say, we're human beings. We're going to make mistakes. We're going to continue to ask questions to break down barriers. And we really just want to be able to share all of that with the communities that we're working in, the families, the clients, our staff, all of that. And so this is a fundamental belief within the organization as well, is being incredibly transparent as leaders and being able to share, like, here's how I messed up this week as the CEO. And here's the work I had to do around that. And continuing to breed really a culture of psychological safety, not only internally, but then communities start to experience us as a really safe place to come to with their problems.
Yeah, I love that. It's almost the idea of accessibility that you started off with on the client or like the patient side is also coming in on the business side, where you have other people who can access what are you doing. So it's fantastic. One last question. Like if you were to have a magic wand and you could wave it for the space, what would you like to see?
I'd like to see more of what we're building. But again, those are my values. Those are our values. I now know, at least I'll say on paper, everything changes in reality. School is very different from the real world, for example. So at least on paper, what I see and our experience over the last year and a half speaks to the idea that we can bring high quality care to underserved populations. I just don't believe that what we need is more high-end private pay residential treatment centers. There are enough of those already. However, there are, huge numbers of people that are continuing to suffer and that have been very institutionalized within the county-based systems all around the United States that continue to be cycled through and don't actually have the experience of being seen, heard, or valued for who they are and provided care at that level that we would typically only experience there. So to me, my magic wand would be that adaptable, accountable, and accessible behavioral health care was a universal right. So every person that had a need would be able to connect with a treatment provider that is providing an extremely high quality set of care that is done transparently, accountability, open, and we're able to really transform communities in that way.
Fantastic. All right. Thank you so much for the conversation, Chris. It was a pleasure having you.
Thank you, Prannoy.